Hey, now it's your turn to get free advice about your family's teeth. Dr. Mark Hyman is here to take your calls about family and cosmetic dentistry. If you have a question for him, the number is 1-800-807-8255. Good morning.
Good morning, Cindy.
And you were explaining your Tar Heel tie earlier as a
victory tie.
Victory tie. Victory tie. He's already predicted the outcome. So
one game at a time.
Mark your brackets appropriately, right?
I'm hoping so.
We're going to go get a couple calls in, and then we're going to talk about some things that you brought today. First of all, how about Debbie in Burlington? Good morning, Debbie.
Good morning.
What's your question?
I have some very, very old, I think they're called amalgam fillings, the silver-looking fillings, and they are starting to fall out. Is there anything I can do to prevent that?
Debbie, the silver mercury fillings, they serve dentistry beautifully. They've been used for 150 years. We have modern materials that are actually a whole lot better. So when a filling is kind of past its expiration date, it's time to talk to your dentist and see what's appropriate. Is it appropriate to do it in white with a porcelain or a plastic composite resin filling, or even consider gold on a back teeth that's still a fine material? Most folks want their teeth to look like natural teeth. So I would speak to your dentist and see what's appropriate. The problem leaving an old cracked filling is it can leak and lead to a root canal, then it costs a whole lot more.
Definitely. Let's go to Linda in Kernersville. Good morning, Linda.
Good morning.
Hi, Linda.
What's your question?
I was wondering if last time he was on, he had a metal thing for dentures. I was wondering how that worked and how expensive it is.
Last time he was on, we were talking about dental implants.
I think you were, yeah.
Right, and basically, depending how many teeth that you're missing, that you could have dental implants done, which is a little titanium sheath that's put into the bone. And again, to speak to your dentist to see what's appropriate. If you're missing all your teeth, to do 2 or 4 or 6 implants, then have a partial denture or full denture lock on to those implants. The strength is magnificent, the cosmetics are great. The expense, you end up spending about $1,500-ish per implant, about $1,500-ish per prosthetic piece that is used on top of it. So it is an investment short term, but long term for the quality of your life, for your health, for your chewing, for your ability to smile and sing and kiss. It's really worth doing.
Let's talk a little bit about some of the things that you brought here. This is...
Great. This is a diagnostic wax-up. Somebody comes to the dentist and says, I don't like my smile, my teeth are chipped, yellow, broken. Historically, we would make models and just do a wax-up and say, here's what's possible. And that's kind of cool. The patients can touch it and feel it and look at it and show significant others. What's even better now today, this is the Smile Style Guide.
It's a catalog.
And it's a catalog where you can look at the exact size and shape and color that you want for each tooth. And your dentist can show you this. They can do an imaging of you with a picture of your smile with that smile on you. And so you can say, I want square teeth, I want square tapered, I want rounded edges, exactly the color. Your dentist can image you, print this out. You can show family, friends, and decide what's appropriate for your smile. So it's a wonderful way to make you look good and feel good and have your teeth last a long time.
So instead of picking your clothes out of a catalog, you can now pick your smile out of one. There you go. Okay, Phyllis has been waiting. She's in a rural hall. Good morning, Phyllis.
Good morning.
Hi, Phyllis.
What's your question?
I would like to know if there is an age limit on getting implants. Is it like a cutoff date?
I would say the cutoff date for implants, Phyllis, is 120, roughly. To me, if you're healthy enough, why not get this done to improve the quality of your life? We've had patients in our practice get implants in their 80s, potentially in their 90s. The negatives for dental implants, if you've had osteoporosis medication, the bisphosphonate drugs, that can compromise your healing. If you're a poorly controlled diabetic, you've had radiation chemotherapy, that can compromise it. But basically, if you're healthy enough to get the procedure done, I would speak to an oral surgeon, your general dentist, a periodontist, and see, are you a candidate? And if you are, it takes about 3 months to heal, and the quality of your life skyrockets. So I wasn't being facetious with you, but I think if you're healthy enough to get it done, why not?
You can eat so many of the foods that you've always eaten that you may be limited to when you have dentures that aren't anchored by implants.
Right, so it's a quality of life, it's a healthier nutrition. the
Yep.
bone stops dissolving away, and again, life is better that way.
Yeah, my mom just went through that, so I know we've lived it at my house
Wonderful.
in Blacksburg, Virginia. All right, thanks so much for being with us.
Good to be back, and go Heels.
I knew he was going to say that.